Imagine experiencing a sudden wave of dizziness, ringing in your ears, blurred vision, and difficulty speaking, all before a debilitating headache even begins. This isn't a stroke. This is a migraine with brainstem aura. Also referred to as basilar migraine or vestibular migraine, this rare form of migraine presents with intense and often frightening neurological symptoms. In today's video, we'll break down what it is, what causes it, and how it can be managed with clarity, clinical insight, and compassion. What is a basilar migraine? Basilar migraine, also known as migraine with brainstem aura, is a rare subtype of migraine that originates in the brainstem. Due to the specific neurological involvement, this condition presents with a distinct set of symptoms, often affecting speech, vision, hearing, and balance. The aura phase in a basilar migraine typically precedes the headache and may involve visual disturbances such as flashes of light, zigzag patterns, or blind spots. It may also include speech difficulties, auditory changes, or altered consciousness. The pain associated with this migraine may occur on one or both sides of the head and can either accompany the aura or follow it. Aura symptoms usually last between 2 minutes and over an hour. The headache phase can vary significantly in duration, lasting from several hours to multiple days. Following the episode, individuals often report significant fatigue and a sense of being physically and mentally drained. Common symptoms of basilar migraine. While some symptoms overlap with other types of migraine, basilar migraine presents a unique neurological profile. Common symptoms include visual disturbances such as static, flashing lights, zigzag lines, or blurred vision, sensitivity to light and sound, numbness or tingling sensations in the face, scalp, and hands. In addition to these, more specific signs associated with basilar migraine include slurred or impaired speech, vertigo or a sensation of spinning, ringing in the ears, tinnitus, partial or complete hearing loss, double vision, impaired motor coordination or balance, reduced level of consciousness or confusion, bilateral tingling or numbness, feelings of anxiety or panic, hyperventilation. Pain from the migraine typically starts in one region of the head and may spread. In some individuals, even gentle touch, such as clothing brushing against the skin, can provoke discomfort, a phenomenon known as allodynia. It is important to recognize that the presentation of basilar migraine can vary greatly from person to person, and even between episodes in the same individual. Accurate diagnosis and appropriate management require a thorough clinical assessment. Complications of basilar migraine. Although the sensory and neurological disturbances associated with basilar migraine are typically temporary, this condition may be linked to more serious long-term risks. One of the primary concerns is an increased risk of ischemic stroke. While the exact mechanism behind this association is not fully understood, individuals with migraine with aura, including those with basilar migraine, appear to have a higher likelihood of experiencing vascular events such as stroke. This risk is particularly elevated in individuals assigned female at birth who both experience migraine with aura and use combined hormonal contraceptives. For this reason, the World Health Organization, WHO, advises against the use of contraceptives containing moderate to high levels of estrogen in individuals with this migraine type. In addition, smoking is a well-established risk factor for stroke. For those with basilar migraine, avoiding tobacco use or quitting smoking altogether is strongly recommended to reduce the likelihood of vascular complications. Causes and triggers of basilar migraine. The exact cause of basilar migraine remains unclear. It is classified as a type of migraine with aura that originates in the brainstem, but the underlying biological mechanisms are still being studied. While a specific root cause has not been identified, there are several known triggers that may provoke an episode in susceptible individuals. Common triggering factors include psychological stress, alcohol consumption, intake of caffeine, foods containing nitrates or nitrites, prolonged fasting or skipping meals, exposure to bright or flickering lights, motion sickness or visual motion stimuli, inadequate or disrupted sleep, strong or irritating smells, including certain perfumes, sudden changes in weather or atmospheric pressure, obesity or being overweight, overuse of acute headache medications, hormonal contraceptives, particularly those with estrogen, hormonal fluctuations, particularly in females during menstrual cycles, use of certain medications such as antihypertensives, neurological conditions such as epilepsy or seizure disorders. Identifying and avoiding individual triggers can be a key component of migraine management. A healthcare provider may recommend maintaining a migraine diary to help pinpoint specific factors that contribute to the onset of symptoms. Diagnosis of basilar migraine. Basilar migraine is diagnosed clinically based on the presence of specific symptoms and a patient's reported history. A diagnosis typically requires documentation of at least 2 migraine episodes that meet the established diagnostic criteria. The process often involves distinguishing basilar migraine from other conditions that present with similar neurological symptoms. While basilar migraine can be confused with hemiplegic migraine, the key difference lies in motor function. Hemiplegic migraine often involves unilateral muscle weakness, whereas basilar migraine usually presents with bilateral sensory disturbances without paralysis. Because symptoms of basilar migraine, such as vertigo, visual changes, and altered consciousness, can overlap with serious neurological conditions, it is essential to rule out other potential diagnoses. These may include epileptic seizures, brain tumors, central nervous system infections such as meningitis, ischemic or hemorrhagic stroke. To exclude these possibilities, a healthcare provider may order imaging studies such as magnetic resonance imaging, MRI, or computed tomography, CT scans. These tests help confirm the diagnosis and guide appropriate treatment. Treatment of basilar migraine. The goal of treatment in basilar migraine is twofold: to relieve the immediate symptoms during an episode and to reduce the frequency and severity of future attacks. For acute symptom management, a physician may recommend nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, to alleviate pain and inflammation, antiemetic medications to manage nausea and vomiting associated with migraine attacks. In cases where over-the-counter medications are insufficient, a healthcare provider may prescribe stronger agents. In certain scenarios, a nerve block may be considered to control severe or refractory headache pain. It is particularly important for individuals to recognize early aura symptoms, as many medications are most effective when administered before the headache phase begins. Early intervention can reduce the intensity and duration of the episode. Preventing basilar migraine. For individuals who experience frequent or debilitating basilar migraines, preventive therapy may be recommended. This may include botulinum toxin, Botox, injections, particularly for chronic migraine patterns, antiepileptic medications such as topiramate, which can help stabilize neuronal activity, calcium channel blockers, such as verapamil, often used to regulate vascular tone and prevent migraine onset. In addition to pharmacological interventions, lifestyle modifications play a critical role in reducing the frequency of migraine episodes. These may include avoiding known dietary triggers such as alcohol, caffeine, and processed foods with nitrates, engaging in regular physical activity to promote vascular and neurological health, practicing stress reduction techniques, including structured relaxation and breathing exercises, maintaining a consistent sleep schedule and avoiding sleep deprivation, eating regular, well-balanced meals and avoiding prolonged fasting, minimizing exposure to excessive noise, bright lights, and other environmental stimuli. Complementary therapies such as yoga, acupuncture, massage therapy, cognitive behavioral therapy, and biofeedback may also offer relief and promote better overall migraine control. At the onset of aura symptoms, patients are advised to cease activity and rest in a quiet, dark environment. Administering appropriate medications during this early stage, even before headache pain develops, may prevent the episode from progressing. While migraine with brainstem aura is rare, its impact on daily life can be significant. Understanding the symptoms, triggers, and available treatments is the first step toward control and relief. If you or someone you know is experiencing complex migraine symptoms, don't wait. Speak to a healthcare professional. Early recognition can make all the difference. Thank you for watching. And stay informed. Stay well.